right? So the past, I don't know, 3, 4, 5 new patients we had over the course of the week, all were like really blown away when I mentioned what chiropractic was. You know, they understood it, their neck hurt, their back hurt, I get it, you know, but they were really blown away when we talked about what chiropractic can do and how important it is for their health. And with that in mind, I want to take a minute or two, I want to share that because it's a really cool concept. If you never heard of this, hang in here for a little bit. You want to hear this. It's really cool because what's going on is ultimately you were designed to run and heal perfectly, to never need a drug, any medical intervention, anything, unless of course, you know, you broke your leg, you got cut, you got shot, you know, some sort of bad, you know, injury of some kind, or maybe you neglected your health, you didn't know any better, you weren't taught any differently. So, you know, you had a heart issue and maybe that can help you. But basically medical intervention is supposed to step in when your body can no longer heal itself from what's going on. So if you had a cut and you're gonna bleed out unless somebody took something and covered that cut, you needed that outside help to save your life, right? You wouldn't have made it otherwise. If you don't need outside help to save your life, then your body will know how to heal. It'll fix itself if it's running right, and that's where chiropractic steps in. So your brain runs everything. I think we all know that. We learned that in elementary school. Your brain runs everything. So for your heart to beat, your lungs to breathe, your bowels to work, your immune system to work, right? Your red blood cells, white blood cells, anything to be created to run right, your immune cells, your immune system, it's all run by your brain. Now it gets to your body through your central nervous system in your spine, right? It's gonna run right through the middle of your spine. And then through little holes on either side of your vertebra, you're gonna have the nerves coming out and they're gonna run to every organ and system in your entire body. Now the important part is, if you're compromised, and if you took one of the nerves coming up the spine, running to an organ, you cut that nerve, whatever's at the end of that nerve is gonna die, right? Because that's bringing life. If your heart, the nerves running to your heart, if you slice those nerves, your heart won't keep running and you won't keep running. So it's really important to have all that nerve function getting to your body at 100%. So when we're looking at the spine and nervous system, there's very specific positions that your spinal cord and spinal canal are supposed to be in. From the side, you're supposed to have very distinct curves around 43, 45 degrees in your neck, mid back and low back, hips and pelvis level. And from the front, you should be skull hair straight all the way down, no lateral motion whatsoever. That's a generic look at it, but that's a really, really good look at having everything function the way it's supposed to be. So now, if a bacteria, a virus, not mention any name of virus, but if one of them came your way, your immune system is going to fight it off because you have all the ability to do so. Your body's running perfectly. Your brain's a tremendous amount of energy that goes down and runs your body, and when you are using that energy for, you know, being out of position and posture or having big overweight issues, whatever the case is, it's going to rob that energy. It's not going to give you any of it to heal. You need that energy to heal. So when you have 100% of that getting down your nervous system out through the nerves to every part of your body, you're gonna be the greatest functioning person that you can be. I was looking at some genetic history and I had a relative who was born in 1800 and died in 1890 something, 93 I think, and was 93 years old. So how's that happen? Well, in 1800s, there was no medicine, there was no, you know, anything. You ate the food that grew near you, you worked near you, and as long as you didn't have some sort of infection or disease that, you know, would kill you or did kill you, but now wouldn't because, you know, things like sanitation are real important. So if you didn't have them, you generally lived for a very long time and generally lived healthier than we live today. So nowadays, there's so many health issues. We're so medicated more than ever before, and it's not supposed to be that way. Our bodies are meant to function and heal perfectly. So if you're thinking about chiropractic, I'd urge you, don't think about pains and aches. It's important. I mean, you don't want to be hurting, but pains and aches come afterwards. If that spine is shifted, the pain and ache may come, you know, a year, 2, 5, 10 later. But if it's shifted, it's compromising and cutting off the nervous system then before the pain comes, and you may have stomach issues, may have headaches, may have breathing issues, may have developmental issues, educational issues, anything that your body can perform, any function, you can have an issue there. So if you have that going on, it's always great to get checked by a chiropractor. We say, when's the best time to get checked by a chiropractor? The first moment you're on the earth, right? To find out what's going on with you. and you should be checked at least once a year. If everything was perfect, once a year, to make sure everything stays right. Don't view it from the medical model. Don't view it as you have symptoms, you got to fix them. If you have something, take care of it, and take care of the cause. Really get well, get your body running right, and then get back on board with your body healing and doing well, and keep it there. All right? That's it, guys. 100%. Just wanted to give that to you, and hope you hear it, and hope it stays with you.